Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, what about the surgical treatment in Graves' disease? Surgical treatment in Graves' disease. Actually, in Graves' disease, we have three types of treatment are available. One we give in the Graves' disease, we give anti-thyroid drugs. Thyroid ablation is done with radioactive iodine 131 and thyroidectomy. Already anti-thyroid drugs and also radioactive iodine therapy is done. Now surgical treatment in Graves disease. In Graves disease, surgery is recommended when radioactive iodine therapy is contraindicated. If radioactive iodine therapy is contraindicated, then we can do surgery in the Graves disease. So, indications of surgery in the Graves disease. Indications of surgery are number one, when radioactive iodine therapy is contraindicated, that is, if the patient has a confirmed cancer or if the patient has a suspicious thyroid nodules. If the patient has a confirmed cancer or if the patient has suspicious thyroid nodules, or in younger patients we cannot do radioactive iodine therapy. If the patient has pregnancy and lactation, we don't do radioactive iodine therapy. If there are severe reactions to thyroid medications are seen, or if the patient has larger goiter and these goiters are causing compressing symptoms of the to the patient, in such cases, because they are causing compressive symptoms are already caused by the goiter, so radioactive iodine therapy is contraindicated. Radioactive iodine therapy is contraindicated if the patient itself is not interested to go through the radioactive iodine therapy. So in such cases we do surgical treatment. These are the indications if radioactive iodine therapy is contraindicated. Then we also have relative indications of surgery. In relative indications of surgery, radioactive iodine therapy is indications of surgery are, it is indicated especially in smokers with mild, moderate to severe Graves disease, because in Graves ophthalmopathy, radioactive iodine therapy will cause progression in radioactive iodine therapy will cause progression of the Graves disease. So if a smoker with severe or moderate Graves ophthalmopathy, it is better to do surgery. Then if the patient has desiring or rapid control of hyperthyroidism, with rapid control, if patient wants, if patient desires of rapid control of hyperthyroidism along with being euthyroid or with chance of being euthyroid, here the patient wanted to become euthyroid by rapid control of hyperthyroidism. So in such cases it is better to do a surgery. If there is poor compliance to anti-thyroid medications, then surgery is indicated. But the important thing in surgery is, before surgery, the patient should be euthyroid before surgery. So before surgery, we will have to convert the patient to euthyroid before surgery. How do you make the patient euthyroid before surgery? By giving anti-thyroid drugs. So anti-thyroid drugs should be given to the patient and the patient should continue using these anti-thyroid drugs up to the day of surgery also. Then, what are the indications of total or near total thyroidectomy? In surgery, we generally do total thyroidectomy or near total thyroidectomy. Now, what are the indications of doing total or near total thyroidectomy? One, if the patient with coexistent thyroid cancer, if the patient has Graves disease, and if he also has a cancer, then obviously, because there is a cancer, we do not want the cancer to spread, or to some of the malignant cells to be left in the thyroid gland. So as a result, we should do surgery, should thyroidectomy should be done. And also for those patients who refuse radioactive iodine therapy, then obviously we should do thyroidectomy in them. If they have severe Graves ophthalmopathy, actually if a patient has ophthalmopathy and if you give radioactive iodine therapy, then this ophthalmopathy worsens, and you do not want to do anything which will cause worsening of the disease. So obviously we should not do radioactive iodine. In such cases, we do total or near total thyroidectomy to the patient. Second, if the patient is given, after giving antithyroid medications, the patient has developed life threatening reactions. So if patient has developed life threatening reactions after giving antithyroid medications, like if the patient has developed vasculitis or agranulocytosis, or if the patient has developed liver disease, liver failure, so due to all these causes, we can do total or near total thyroidectomy, right? Except in all these cases, whereas in remaining cases we can do a subtotal thyroidectomy can be done. And after doing subtotal thyroidectomy, we can leave 4 to 7 grams of remnant thyroid tissue in order to for the production of thyroid gland. So for all the remaining patients, we do a subtotal thyroidectomy, leaving 4 to 7 grams of remnant. If there is remnants of, if actually there should be 4 to 7 grams of remnant, but due to some reason, if the remnants are less than 4 grams, in such cases there is a the in if the remnant is less than 4 grams, then there is a recurrence rate is seen in 2 to 10%. So obviously it is a less recurrent rate, but around 40% of the patients will develop hypothyroidism because of only um, less grams of tissues left. Because less grams of tissue is left, so these patients might develop hypothyroidism.
Thank you, and thank you for watching.